Bismillahir Rahmanir Rahim. Assalamu alaikum. I am Professor Adam Ahmed Adam. You are welcome to this parasitology lecture. It is about Opisthorchiasis. This parasitic disease is caused by Opisthorchis viverrini, and this worm is also known as South Asian liver fluke. Another worm causing this disease is also known as Opisthorchis felinius, cat liver fluke. The worms are almost similar in morphology and pathology. Opisthorchis viverrini ranges from 5 to 10 millimeters in length and 1 to 2 millimeters in width, while Opisthorchis felinius ranges from 7 to 12 millimeters in length and 2 to 3 millimeters in width. The infecting worm, whatever to be, viverrini or felinius, the adult worm resides in the biliary system. This is the main site. An heavy infection may be in the pancreatic duct also of the mammalian host. There are other mammals which can be infected by such worms. Human is one of them, where the infecting adult worm attaches itself to the duct mucosa of the biliary system. This is a life cycle. It starts by infection, and the infection takes place by ingestion of a person, ingestion of the infective stages, which are known as metacercaria. The metacercaria are stages encysted in the skin or flesh of freshwater fish. Freshwater fish is a second intermediate host. Ingesting this fish raw or undercooked will lead to infection, and in the duodenum there will be sort of excitation, and the encysted larvae, they become free and they migrate through the ampulla ovata to the biliary system, where they reach adulthood, and from there they produce eggs which can be carried in the bile into the intestine and ultimately outside in the stool. The adult worm can survive for 10 to 25 years in the biliary system. The patient passes embryonated eggs in stool. If this happens to be in fresh water, the eggs will be ingested by the first intermediate host, which is the freshwater snail. And in this snail, the egg hatch releasing meracidia, and this undergoes several developmental stages through sporosis, redii, and ultimately cercariae. And the cercariae shower out, they come out from the body of the snail into the water, they swim for some time, and ultimately insist in the flesh or skin of a freshwater fish. The insisted metacercaria, they become metacercaria. So the cercaria, when insist in the fish, it becomes metacercaria, and this is the infective stage. And here you see the life cycle in writing. So the clinical manifestations depend on the worm load. So most of infections are asymptomatic, and most of the pathologic manifestation result from the inflammation and intermittent obstruction of the biliary ducts. In mild cases, the patient may just become dyspeptic with abdominal pain, diarrhea, or constipation. In chronic infection, that's a prolonged duration, the symptom can be severe and they may lead to hepatomegaly and malnutrition. So the patient may present with cholangitis, cholecystitis, and maybe cholangiocarcinoma. In case of Opisthorchiasis fellenius, it may the infection may present with an acute phase resembling Katayama syndrome or Katayama fever. Once again, rarely but seriously, it can lead to cholangiocarcinoma, which is a serious disease. And this worm, Opisthorchis species, is classified as group 1 carcinogen. There are 3 parasites which are considered to be in group 1 carcinogen. They induce cancer. These are Opisthorchis, Clonarchis, and Schistosoma hematobium. The diagnosis, clinical assessment, then the investigation in the lab, the specimen to be collected, mainly the stool, and also if endoscopy is done, so the gallbladder contents, and even the gallbladder contents can be sampled if the patient undergoes operation. So the duodenal aspirate, microscopically the egg is oval in shape with an operculum at one pole and a knob at the other. I'd like to mention here that the eggs of Opisthorchis viverrini and also Fellenius are indistinguishable from those of Clonarchis sinensis. So morphologically they are quite similar. Also, the adult flukes or worms are recovered as surgery, can be recovered as surgery. That were recovered as surgery and also pass after antihelmintic treatment. The treatment is by praziquantel with a dose of 25 milligram per kilogram body weight 3 times a day for 2 to 3 consecutive days. Prevention, improvement of personal and environmental hygiene, avoidance of eating raw or undercooked fresh water fish because they contain the insisted infected stages. Thorough cooking fish, so the fish should be thoroughly cooked until the heat reaches the internal parts of the fish. So the internal temperature should be 63 degrees Celsius or more. Then health education to educate the people how the infection takes place. And then adoption of hygienic practice. By this, the lecture is over. I hope that it's understandable and I wish you all the best.